Warning, censorship. Warning, censorship.
Masks do not work. We know that even in the operating room. We've done studies showing that surgeons wearing masks during operations did not reduce the number of wound infections.
Drea Humphrey here with Rebel News. I'm standing in front of the Ministry of Health building in Victoria, BC, and I'm not alone. Dr. Stephen Malthouse is here too. Now, Dr. Malthouse has written a letter that's gone global, and it was addressed to Dr. Bonnie Henry, our Chief Public Health Officer. Now, she hasn't replied back to him, but I thought that you guys would really like to hear some of the things that he has to say. So let's get right to that. I'm here with Dr. Malthouse. He was one of the speakers at this protest today, and you're quite brave to be standing out and doing this. And one of the things that you did in BC was write a letter addressed to Dr. Bonnie Henry. I read that letter. It was a really good letter, and it's spread across the globe now. So why was it important for you to come here today and speak at this protest?
Well, there are many people that have the same ideas and have examined the evidence and come to the same conclusions, that what is coming out of the Ministry of Health here, what Bonnie Henry is putting into policy, is not healthy. It's causing a lot of harm to people in the province, and it needs to stop. And unless doctors stand up, speak out, there won't be anyone who gives credibility to what everyone else is noticing. You only have to be on the street a short period of time to see people, young people wearing masks that they pull out of their pockets. People are afraid of each other. People are doing things which are not healthy, and they're waiting for a vaccine illusion to save them from their fear. What I'm seeing is that the Ministry of Health, which should be downplaying the risk, because there are very few risks of getting a coronavirus at this stage, at least the COVID-19. And instead of doing that, they're ramping up the fear in the general populace by talking about cases. And we know that cases are not necessarily sick people. They're often based on a positive PCR test. PCR tests can be up to 90% false positive. So if 10 people get a positive test, it may be that only one of them has actually got evidence of ever being exposed to COVID-19. This needs to change, and doctors need to step up to the plate. If we're talking about cases without talking about people that are hospitalized or in the ICU or deaths, which are much more reliable measure of what's going on with COVID-19, then essentially we're not exactly lying, but we're not giving the information that will help people make an informed decision. And to be aware that they're not in danger.
And there definitely has been a shift. I'm not sure why most people haven't noticed. It went from death count, and now it's just cases. One of the things in your letter that you discussed was a comparison about Sweden. I mean, Sweden was mocked in mainstream media for taking an approach that we usually take in this type of situation. It's us who are doing things differently this time around. And you mentioned some of the stats as of September that they were seeing. Can you explain those a little bit?
Well, Sweden had a very light touch. They let their own citizens decide what was good and what was bad, and most of them have common sense. They know that if they have a runny nose or a cough that they stay home, and they don't go out and hang around their friends and pass it around. So they trusted their citizens to make the decisions. Here we're doing a top-down clampdown, and it is not based on the evidence of the science. So Sweden, yes, they had deaths there. They had deaths because a lot of people in long-term care homes were frail and elderly, and they had not good nutrition. Perhaps they didn't have vitamin D supplements, which you need in northern climates. Those people died, and they had a death curve which is very similar to the rest of the world, many different places. It's hard to compare country to country. It's better to see what the death rate is, the all-cause mortality, year to year, and see whether what's happened with this so-called COVID-19 pandemic is out of the ordinary. And we haven't seen that in any countries. So what they have now is a return to pre-pandemic levels of disease. But what they have that the rest of the world doesn't have is an intact economy. They don't have the deaths from despair. They don't have people with fear that is so severe that they themselves and their children are afraid to come out of their houses. They don't want to touch their grandparents. They're just what we've done in the rest of the world is we've taken the humanity out of it, and we need to put that back. Sweden never did that because they used common sense and they had a government which made good policies, not like what we're doing in Canada.
Yeah, definitely a different approach, and it's interesting because in some cases their death rate is actually faring better than those that heavily lock down. And in British Columbia, we haven't had as extreme of lockdowns as everybody else, but now we have only a safe 6 that we're allowed to visit with and things like that. One of the things you mentioned that was quite refreshing to hear from a doctor is you mentioned vitamin D. And it's amazing because you don't hear that from Dr. Bonnie Henry, the importance of, using vitamin D. Why do you think that is?
I don't know why she hasn't mentioned it, to tell you the truth. It would think that would be a number one on her agenda. When you look at immunity, it should start inside. It shouldn't be at masks and hand washing and isolation and those sort of things, which are not supported by science in this situation. It should be improving your general health through proper nutrition, getting some fresh air, sunlight, having loved ones around you, saying a joke or two, and taking supplements, because we know in the wintertime that everybody in Canada, everybody above 35 degrees latitude, is going to be vitamin D deficient by the time they get to the 3rd week in October. So people should be taking a good amount of vitamin D, and usually for adults that's 4,000 international units, and then have your blood tested, say in December, to see if you're absorbing it properly. But we know in the elderly, they don't go outside in the sunshine, they have thin skin, they're not well nourished from their eating habits, they're indoors all the time, and they're all going to be vitamin D deficient. And we know the evidence is that vitamin D is very important for fighting off viral infections. It's been shown through several very good studies that people who had COVID-19 did better if their vitamin D levels were higher. In a study in Malaysia, they showed that people who had high vitamin D levels had a 0 mortality rate from COVID-19, where those that didn't in the same study had high mortality rates. So taking vitamin D, vitamin C, a good multivitamin, selenium perhaps, magnesium perhaps, and omega-3s. That's a good thing to do right now over the winter to protect against getting viral infections, but it'll have other effects too. People will find that seasonal affective disorder, which comes from the lack of sunlight this time of year, will disappear if they're taking enough vitamin D in many cases.
Yeah, I know vitamin D is also important for Black people as well, right? So that's one of the things that's more important for us. It would be nice if our top doctors would explain this to people to help combat COVID-19. Now, what's it like? You're not the only doctor in Canada speaking out about this. There's a handful coming forward in Ontario, which is nice recently. And then around the world, there's doctors speaking out the things that you're saying as well. But what is it like coming out and saying these things? Are you getting any kind of backlash? How are your own peers approaching you about this?
Well, of course, I haven't heard anything from Dr. Henry's office, and I don't expect. I mean, what can she say? Oops, I made a big mistake? I don't think so. I have heard from the college, and they want to interview me, which is understandable. It's a self-regulating profession. And at first, I thought I would give up my license, because I could see that they're going to run this right up to an investigation. But then I talked to some people, and I changed my mind. I decided that it would be better to fight back. This is a question of free speech, and that we shouldn't be gagged. We shouldn't be masked as doctors against speaking out what we think is right. And particularly if we see something being done which is harming people in the general population and our patients, we have an obligation to speak up. That's the oath we took.
Absolutely, and we've seen how dangerous it can be when doctors speak up and get silenced. We saw that with the spread of the coronavirus, with doctors being silenced in Wuhan when they tried to come forward and warn the world. So it doesn't matter how many doctors are speaking up. That's an important medical opinion. And you mentioned masks, so I'm going to ask you about masks. What is your take on masks and people having to wear non-medical, non-respirator masks, just face covers, bandanas, whatever covers your nose and mouth?
It really does not make sense. Masks do not work. We know that even in the operating room, we've done studies showing that surgeons wearing masks during operations did not reduce the number of wound infections. But if we look at the coronavirus, it is only 0.1 microns in size. Even an N95 mask can only block 0.3. Now, most of this virus is spread by aerosol, which means it comes out the tops, the sides, the bottom of the mask. It goes in plumes, which can go 26 feet by studies. It can linger in the air from 1 to 3 hours. So to think that you can stop that by taking an old handkerchief and sticking it over your face, that's crazy. And if you go out and look on the street, you see that even if you have a nice mask, people don't know how to wear them. They're contaminating them by touching them all the time, moving them around. Look at Dr. Fauci. You can get pictures of him sitting in the background, touching his mask. I mean, it just does not make sense. So, even if masks did work, the way people wear masks would completely undo that. And, in the United States, OSHA, which follows occupational use, the safety wearing masks, everybody's individually examined to see if they can tolerate a mask. They're not encouraged to wear them beyond short periods of time. They have to be properly fitted so that they seal as best they can. And we know that people's oxygen tensions go down in masks and their carbon dioxide goes up. This is going to have short-term effects, which could be as simple as fainting and having a head injury or driving your car into a tree. And it could have long-term effects. Chronic hypoxia of the brain is going to cause people to have speedier onset of dementia, other neurological diseases. And for children, this is going to really interfere with their ability to learn. It's going to cause irreparable, which means irreversible damage to their learning centers in their brain, chronic hypoxia. We've got to stop putting masks on kids, and I do not recommend anybody wear a mask. If you have a cough or a cold, use your common sense. Stay home. Don't sneeze on people,
Don't make out with a stranger, right?
Don't make out with a stranger. But
in the grocery store.
But if we look at people wearing masks, it's a gag. It's stopping people from talking about the important issues here, which is that the science does not hold up the policies. And if you're walking around with a mask and you're frightened of going within 6 feet of people, your loved ones or anybody, humans, then if you do that, then that prevents you from being part of the human family. And there is other things going on here which go beyond the medical aspects, go beyond these policies. And although we won't go into that, part of it is undermining humanity, the human family. Even in doctors, we have to go and touch patients and see them in the office. Don't see them on a screen, and don't just do your interview over the telephone. We need to actually go hold people's hands when they need it. We need to speak to them in person. We need to be in their zone. That's what real doctors do.
I think that's absolutely right, and the psychology of it all too. I was in Costco in a sea of masks, and there was this really adorable little girl, and she had a Mickey Mouse hat, and I wasn't wearing a mask. I gave her this huge smile, and she just lit up, and I thought, how many smiles is that little girl missing? She's looking up at all of these masked people, and no one's doing what they do, which is smile at cute little kids. And how is that going to affect them?
There are a handful of doctors that's growing that know something is wrong, and they're starting to talk to each other and create networks, and some of them are speaking out in letters and in videos on the internet. And I think what they're going to say to you as an audience is, don't listen to mainstream media. It's giving you a one-sided narrative that is not accurate. It's misleading. It's funded by, let's say, 50 to 70% of their income, which comes from the pharmaceutical companies. So I think you need to go on the internet, and I think you need to find good sources of information, but put your TV in your garage.
Well, there you have it. I wonder if this is the start of more BC doctors speaking out against some of the decisions that our health advisors are making and the restrictions that we are seeing or being threatened with. Like, will we be able to spend Christmas with our family or whatever holiday you want to celebrate with your loved ones? Let me know what you think about it. Drea Humphrey for Rebel News. Here at Rebel News, we bring you the other side of the story, and that includes doctors who are speaking out for the first time. If you value the independent journalism that we do, you can help support us by donating at helprebelnews.com. Anything that you can donate, we appreciate very much.